International organizations unite to launch a global call to action against disease-related malnutrition. On September 5, 2022, in a landmark step to fight disease-related malnutrition, international clinical nutrition societies, ESPEN, ASPEN, FELNP and PENSA, in conjunction with the European Federation of Association of Dietitians, the European Patients Forum, and over 75 associations from across the globe signed a declaration recognizing nutritional care as a human right at the 44th ESPEN Congress on Clinical Nutrition and Metabolism. The International Declaration on the Human Right to Nutritional Care is a global call to policymakers, medical associations, and civil society organizations for urgent action against disease-related malnutrition. This global effort underscores the need to give solutions to disease-related malnutrition, a condition that concerns 30 to 50% of the hospitalized patients. The declaration is a global consensus committed to raise awareness on the importance of disease-related malnutrition and highlight the lack of nutritional care for people suffering from chronic and acute diseases. Although this declaration does not have a binding legal effect, it has an undeniable moral strength. The declaration sets a shared vision and principles for implementation of the human right to nutritional care for all patients. The declaration recognizes that access to nutritional care is a human right intrinsically linked to the right to food and the right to health. Principle 1. Public health policy must make the fulfillment of the right to nutritional care a fundamental axis in the fight against disease-related malnutrition. Principle 2. Clinical nutrition education and research is a fundamental axis of the respect and the fulfillment of the right to nutritional care. Principle 3. Ethical principles and values in clinical nutrition, including justice and equity in nutritional care access, are the basis for the right to nutritional care. Principle 4. Nutritional care requires an institutional culture that follows ethical principles and values and an interdisciplinary approach. Principle 5. Patient empowerment is a key enabler to necessary action to optimize nutritional care. Through these principles, the Vienna Declaration seeks to protect those at nutritional risk and malnourished patients. The signing ceremony included messages and addresses by ESPEN Chairman, Rocco Barazzoni, FELNP President, Eni Ferreira, ASPEN, President Ryan Hurt, and Director of PENSA Society, Soronit Siltham. The importance of nutritional care was further underscored by patient representative Marek Lichota. Further indicating the relevance of the initiative, salutations were given by European Commission, DG Sante and WHO Europe representative, Stefan Schreck and Kremlin Wickramasinghe. At the Congress, ESPEN chairman said, "We hope that the declaration will bring much needed attention to the importance of nutritional care, and will prove instrumental in reducing and eliminating disease-related malnutrition globally." That is why ESPEN propose an action plan that will aim at generating tools to promote the translation of the 5 principles of the Vienna Declaration into consistent actions to promote access to nutritional care for all patients. Principle 1. ESPEN will design and launch a policy brief on disease-related malnutrition to bridge the gap between the healthcare professionals and policymakers, to defend right to nutritional care and effectively address malnutrition. Principle 2. ESPEN will prepare a complete toolbox of educational material for nutrition education in medical schools in the context of the NEMS action and will continue to support and promote best research by supporting research projects, especially by younger researchers. Principle 3. ESPEN will expand and update its guidance material on ethics in clinical nutrition. Principle 4. ESPEN will continue to promote its activities to identify disease-related malnutrition risk, diagnose and treatment, including the Nutrition Day with new interdisciplinary actions and the GLIM strategies. Principle 5. ESPEN will promote inclusion of nutritional care among patients' rights in patient charters. This implementation program will also represent a platform for collaboration with policymakers and other key stakeholders, to fight against disease-related malnutrition.
Learn more, share the declaration and help us to defend and promote the right to nutritional care.